Every young drummer wants to be flashy and play fills all the time and be really technical with everything, but a true drummer is one that you can set your watch to. He sets the backbone for everything. I guess where I am today, everything started with my grandma. She's the one that carried the torch, my last direct relation back to the Menominee tribe. A lot of traits that I've heard stories about in Chief Oshkosh I've seen passed down to my grandma and to my dad. Hopefully to me, I'm still honing them every day, but trying my best. My name is Aaron Robinson. I'm a fourth-year medical student at the University of Wisconsin School of Medicine and Public Health. I'm currently completing my Master's in Public Health degree at the University of Minnesota. I'm working on the research team at Hennepin County Medical Center in Minneapolis. So we're kind of looking at how the prevalence of a disease in a population is affecting the proportion of that disease that we see in the emergency department. I became interested in emergency medicine partway through my third year of medical school. I wanted to take a year and study things from a population perspective, see what it's like at the individual level, and then connect that with the community level.
How do they look?
Isn't red, not too pale?
Not too pale?
No.
Probably do some blood work and x-ray.
What is this person coming in for, and what are they being treated for on an individual level? Backtracking a little bit and going back to their upbringing or society or their community, how can we educate or influence the population so we can reduce the number of people that come and see us? We do a better job about controlling violence, we can reduce the number of violent crimes coming into the emergency department. If we lower the obesity rate, the theory is that we're gonna have less people coming in with heart attacks. It's seeing how we can interact with the community as physicians and other healthcare leaders and affect our setting in the emergency department. I grew up in kind of a medical family. My mom was a nurse at a state mental institution, and then my uncle is a doctor down at UW in internal medicine. Growing up, I always saw myself as a physician, but never saw myself in a native setting because I wasn't really immersed in the culture at all, and myself and my brother were the only native students in our school. Not growing up on the reservation, my only connection being my grandma, it was difficult for me to learn about Menominee culture through anybody but my family. As I'm growing older, I'm starting to understand those cultural things more and kind of realize and connect with my own life what those things mean to me. It's allowing me to respect and try to understand other people's cultures because I'm going to be working with people with a variety of different religions, beliefs. Being able to connect with them and to balance medicine and respect of culture, I think, is an extremely important thing, especially an emergency physician where you can have anything coming through that front door.